Hey, anatomy students. Today we're going to do a video about the 12 pairs of cranial nerves that emanate from the brain, creating a sensory and motor connection between that brain and structures of the head, the neck, the thorax, and the abdomen. So I can see all 12 cranial nerve pairs in yellow here. Notice they all have names as well as numbers, which are typically given in Roman numerals. And realize that the numbering is going from front to back and then from superior to inferior. Okay? All right, here is a listing of all our 12 nerve pairs. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus accessory, and hypoglossal. We got to know those names as well as the associated number. A mnemonic device that might be helpful is old OP occasionally tries trigonometry and feels very gloomy, vague, and hypoactive. It's a pretty good one. Not the most memorable one. Another good mnemonic device is some say marry money, but my brother says big brains matter more. This tells me whether the nerve is sensory, motor, or both sensory and motor. All right, so keep these mnemonic devices in mind. And let's go through a few classifications. We're going to have 3 cranial nerves that are sensory only. So olfactory, which of course is involved in smell, optic, which is involved in vision, and vestibulocochlear. Then we're going to have 5 that are motor only. The oculomotor, the trochlear, the abducens, which all move the eyeballs, the accessory, which moves the head and the shoulders, and the hypoglossal, which moves the tongue. And then we're going to have 4 that do both jobs, sensory and motor. Trigeminal, facial, glossopharyngeal, and vagus. So we're going to go through all 12 nerve pairs one at a time. Sensory nerve, the first cranial nerve is a sensory nerve, and it is the olfactory nerve. We know olfactory has to do with the sense of smell. We see fibers of the olfactory nerve in the superior nasal cavity in what's called the olfactory epithelium up here. Then those nerve fibers are punching through the olfactory foramina in the cribriform plate of the ethmoid bone, where they are synapsing with cells in the olfactory bulb on the ventral surface of that frontal lobe. So smell information, sensory only, traveling via cranial nerve number 1, the olfactory nerve. So if you were smelling these delicious coffee beans, you would be using your olfactory nerves. Now nerve number 2 is the optic nerve. We see an optic nerve coming out of the eyeball here. Begins in the retina. Fibers come through the optic canal in the sphenoid bone. We see the optic nerve coming back from each retina. Notice that some of the fibers cross over, some of the fibers do not. The crossover point is called the optic chiasm, and this creates a contralateral field of view, meaning what you're seeing on your right field of view goes to your left brain, and what you're seeing in your left field of view goes to your right brain. And we see the continuation of fibers as the optic tract here and here, going back to the thalamus, which does its usual sorting and filtering job. And then eventually the information travels back to the visual cortex, which we know is in the occipital lobe. All right, number 3. Number 3 is a motor-only one, as its name indicates. It is the oculomotor nerve. Ocula means eye, so oculomotor is an eye mover. And the motor fibers here are going to be both somatic, controlling skeletal muscle, as well as parasympathetic, controlling smooth muscle. The oculomotor nerve comes out of the midbrain, front of the midbrain here, travels through the sphenoid bone, through that superior orbital fissure right there, and gives off a lot of branches because it is going to multiple muscles. In fact, The somatic part of the oculomotor nerve goes to 5 different muscles. The superior rectus, which is on top of the eye and is going to help you look up. The inferior rectus, which is on the bottom of the eye and helps you look down. The medial rectus, which we do not see in this picture because it's on the inside medial surface of the eye, helps your eye look inward towards your nose. Then also this muscle here called the levator palpebrae superioris, which elevates the eyelid. That muscle is failing. You can see what can happen right there. Okay, so the parasympathetic portion, in other words, the autonomic portion, innervates smooth muscle. So here is our pupil right here, the iris around it. That is where we're going to find pupillary sphincter and dilator muscles, which are going to dilate or constrict the pupil. So of course, dilate in dim light, constrict in bright light. And that is the parasympathetic part of the oculomotor nerve. There's also something called the ciliary muscle, which adjusts the shape of a structure in your eye called the lens. You change the lens shape when you're switching between distance or close-up vision. The lens is nice and thick for close-up vision, flatter, skinnier for distance vision, and the ciliary muscle's contraction is what lets you switch between focusing on something close up and focusing on something far away. And that is smooth muscle as well, controlled by the oculomotor nerve. And by the way, the lens will grow stiff as you get older, which is going to make it hard to do this part, which is going to necessitate reading glasses at some point in your life. All right, so that was number 3. Number 4 is the trochlear nerve. Weird in that it comes off the back of the midbrain. So all my brainstem nerves come off the front or the side. This is the only one to come off the back. Comes off the back of the midbrain, goes around the brainstem through that superior orbital fissure of the sphenoid bone, then synapsing with just one skeletal muscle called the superior oblique, which is going to help roll your eye kind of down and out, and that's involved if you're doing like an eye roll sort of motion. You're going to use that superior oblique muscle. The word trochlear refers to a little pulley-like structure that the tendon is going through called the trochlea. So that is number 4. Number 5 is our first mixed nerve, the trigeminal nerve. Comes out of the brainstem where the midbrain and the pons meet. Quickly branches into 3 big branches. That's why it's called the trigeminal nerve. It's got 3 divisions. The first 2 divisions, the ophthalmic and the maxillary, are purely sensory. And then the last one, the mandibular, is sensory and motor. So you can see the regions of the face that the different divisions of the trigeminal nerve are going to get sensations from. So basically we've got eyes, forehead, bridge of the nose for the ophthalmic. We've got the jaw and the jawline extended for the mandibular, and then kind of in between for the maxillary. Now, it makes sense that the mandibular is the one controlling motor function as well, because if you remember from lab, the trigeminal nerve also controls chewing muscles. And there are a pair of chewing muscles we've got to know. There is a temporalis muscle and then a masseter muscle. Temporalis muscle is easy to feel in your temporal region, grabs onto your mandible and elevates it. The masseter, the word refers to mastication or chewing, also elevates the mandible. And these 2 guys are controlled by that mandibular division of that trigeminal nerve, which is the only one that has motor and sensory functions. All right, number 6 is our final eyeball nerve. This is the abducens nerve. Comes right off the bottom of the pons right there. Again, slips through that superior oblique fissure right there, superior orbital fissure rather, and then comes up and innervates with just a single muscle, the lateral rectus muscle, which helps your eye look out. In other words, it helps abduct your eyeball. That's where abducens comes from. If that muscle is not working, you can see how the eye can tend to drift like so. Okay, we are exactly halfway through these different cranial nerves. Let's see if we can go on and do the next 6, starting with number 7, the facial nerve. So we had the trigeminal nerve. That was a mixed one we did already. The facial nerve is another mixed one. Comes out of the inferior pons. And as far as sensory goes, it is going to do taste sensation from the anterior 2/3 of the tongue. So anterior 2/3 of the tongue, taste sensation from there, as well as somatic sensation like touch, pressure sensation from your external ear. Think about like putting a Q-tip in your ear and feeling its presence from your palate, so the roof of your mouth, and as well as the nasal cavity. Think about like the sensation of some particle of dust in your nasal cavity making you want to sneeze. So those are my sensory jobs for my facial nerve. Now, the motor jobs are twofold. So it's going to go to glands as well as to muscle. So motor, remember, means we're going to an effector, which is usually a muscle, but it could be glands as well. And the glands we're going to go to are lacrimal glands, which are making tears, mucus glands in the nose, which of course are making mucus, as well as a pair of salivary glands, one under the mandible called the submandibular gland, and one under the tongue called the sublingual gland. So those are the glands that we stimulate with our facial nerve. Now, there's also muscles that are going to be stimulated. Basically, broadly speaking, the facial nerve is going to control muscles of facial expression. So muscles like your orbicularis oculi, which we'll learn in lab, your orbicularis oris, which we'll learn in lab, your zygomaticus major, which we'll also learn in lab, as well as a bunch of other ones that we're not going to cover in lab. But basically, facial expressions controlled by your facial nerve, which is cranial nerve number 7. Now, if for some reason the 7th cranial nerve stops working on one side, you can get a situation called Bell's palsy, and we can see just the drooping of the facial features on this one side because we're not stimulating the contraction of the muscles of facial expression on that side. All right, that is nerve number 7. Nerve number 7. Nerve number 8 is the vestibulocochlear nerve, which is our final purely sensory nerve, coming right out from where the pons meets the medulla oblongata. And this nerve, like its long name suggests, is going to have 2 components. There is going to be part of it called the vestibular nerve, which is from structures in the inner ear, which are concerned with balance, structures like a vestibule and semicircular canals. Then there's also a cochlear nerve, which is coming from this structure called the cochlea, snail-looking thing, and this is concerning hearing. So balance and hearing are my 2 jobs of my vestibulocochlear nerve. All right, that was a quick one. Number 9 is the glossopharyngeal nerve. This is another mixed one. We only got 2 more mixed nerves to go. Comes out of the superior medulla. This one's going to do sensory information about taste from the posterior third of the tongue. So glosso means tongue. And This guy has some tongue involvement, but not as much as the facial nerve. Remember, the facial nerve did the anterior 2/3 of the tongue. So even though this guy's got glosso, which means tongue in his name, he only does taste sensations from the posterior third. Also is going to get sensations from the throat. So the sensations you can feel as you're swallowing a cold drink, for example, as well as it's going to get information about blood pressure from the carotid arteries. Carotid arteries here, especially this wider internal one here, is taking blood to the brain, so it's crucial to measure blood pressure here. Okay, so that's the sensory part of my glossopharyngeal nerve. The motor part is going to be twofold. So it is going to stimulate a small muscle involved in swallowing. So there's one small muscle involved in swallowing. This guy called the stylopharyngeus. And then it also stimulates one big gland involved in salivation. So small muscle for swallowing, big gland for salivation. And this big salivary gland is the parotid gland. The word parotid means near the ear, because that's where this gland sits, kind of like on the ramus and the mandible. So some similarity between the glossopharyngeal and the facial nerve, but some differences as well. Okay, the last of the mixed nerves is the vagus nerve, number 10. Comes out of the medulla. It's going to have a couple sensory things for us. Taste sensation from the throat. Blood pressure from the aorta. The aorta is the first artery in what's called your systemic circulation, which is going to your entire body. So it makes sense to measure pressure there. The vagus nerve also carries sensory information from your larynx, your trachea, your lungs, your heart, your esophagus, your stomach, and your intestines. Think about how you can feel your esophagus if you're, swallowing something cold. Think about the stretch of your stomach or the discomfort if you've got too much gas in your intestines. All those sensations are coming back up to the brain via the vagus nerves. Now, as far as its motor job, it does a lot of different things, including controlling your pharynx and larynx when you're swallowing and speaking, so going to a lot of muscles there. So the glossopharyngeal had some roles in this, but your vagus nerve has a greater role. It also increases smooth muscle activity and secretions in digestive organs, so stomach, pancreas, intestines, liver, gallbladder. It decreases the rate of cardiac muscle contraction. It also relaxes and dilates tubes in the lungs. So the majority of this, let's take a look here. So I've got some somatic functions here. Like this is somatic right here because I'm going to skeletal muscle. But this is all autonomic. And remember, my autonomic had a parasympathetic and a sympathetic branch. And this is all parasympathetic. So my nervous system that's controlling, that's doing all of these three jobs here is parasympathetic. And if you remember, the parasympathetic branch had a nickname, which was called the rest and digest branch. And notice how we got a lot of things involved in resting, like the heart rate going down, as well as digesting. So keep that nickname in your brain as you remember all of these multiple functions. And by the way, the word vagus means wanderer. It's not a very real English word right there. Wanderer, one who wanders, because the fiber goes to so many different places. All right, on that note, we're done the vagus nerve. We got 2 to go. Next up is number 11, which is the accessory nerve. It is a purely motor nerve, and our final 2 are purely motor, has both cranial and spinal components. So the cranial component comes out of the medulla, goes to the larynx with fibers from the vagus nerve. And then the spinal component comes out of that cervical spinal cord. And by the way, look at that cervical enlargement. So nice right there. So fibers are coming out of the cervical cord, going up the foramen magnum, sneaking out another foramen to go to a pair of big muscles, the sternocleidomastoid, which I see right here. This is a muscle that is involved in both saying the yes motion, so nodding your head up and down, as well as the no motion, so rotating your head left and right, as well as a big shoulder muscle called the trapezius muscle. My accessory nerve goes to my superior part of my trapezius muscle, which is going to let me shrug my shoulders, so elevate my shoulders. So that is the jobs of my accessory nerve. And then my final cranial nerve, number 12, coming out of the bottom of the medulla, also a motor nerve. It's called my hypoglossal nerve. Hypo means under, glossal means tongue. So this nerve is under the tongue, and in fact it goes to most of the musculature controlling the tongue, including both extrinsic tongue muscles that are outside of the tongue and intrinsic tongue muscles that are inside the tongue. And these are muscles that are all involved in either changing the shape, position, or moving the tongue around. And so those are all 12. Those are all 12. And I got a pair of pictures for you to look at here. See if you can figure out how these 2 faces are constructed. See if you can figure out what they are trying to convey in these 2 nice faces. And tell me which one you like better, the first one or the second one, because I'm not sure which one I like better. All right, shortest lecture video of all time right there. Done with the cranial nerves. See you next time. Bye-bye.